I would definitely have said I was healthy, health conscious even. Every day I followed the standard advice for healthy eating, exercise, alcohol, sleep, same old. But with each year of my 20s that passed, the more tired I became. I thought this was a normal side effect of aging and blamed long working hours for all the countless colds and bugs that would bother me during weekends, holidays, or any downtime. Luckily, I was an early adopter of Randox Health. I remember being really apprehensive before my first one a few years ago, but straight away understood how this is a game changer. I've had a complete Randox Health program every year since, and here's why. This is how Randox Health saved my life. The first time I must have had around 120 biomarkers measured on the blood sample Randox collected for me. The report was great, lots of data, lots of education, all about me. I must have showed that to everyone twice. I personally was delighted that my heart was really healthy. 20 different blood tests confirmed this. I gained peace of mind that my liver wasn't being impacted by my weekly social scene, and childhood kidney problems had not left any lingering damage. Everything was overall positive, but about 10% of things were not good and needed to be corrected before they caused further damage. Like my iron level was low. The stores of iron in my body were apparently non-existent, to the point where I may have just passed out if I had have stopped eating iron in my diet. A few of my many hormone results seemed a bit irregular, and one of my white blood cells was worryingly low. As a vegetarian who was also dependent upon daily doses of sugar and caffeine, the Randox scientist was able to tell me that these chemicals could suppress the production of white blood cells in the body, so my white blood cells needed attention. My body had weak defense systems. I couldn't fight off the common colds or bugs around me. But the good news was that the Randox measurements displayed all the other parts of my body at the same time. Therefore, I wasn't as worried as I would have been should I have only had that test on its own, or if I had have believed Dr. Google, which stated the results likely linked to leukemia and/or HIV. The out-of-range results suggested adrenal fatigue to do with my hormones, that the glands and regulation activities in my body were worn out. An advanced test from Randox for inflammation measurements would help identify and understand this problem at the earliest opportunity. I was able to focus in on what needed to be corrected and how best to act upon it. I could actually improve and measure the improvements. I wanted to sort it early when it was easier to fix and prevent long-term damage. So for the white blood cell concerns, I showed my blood results to a specialist blood consultant, a hematologist at the local NHS hospital. He told me it wasn't anything to be concerned about. One, I wasn't experiencing any symptoms, and two, the other results all looked okay. In his opinion, there was no results of clinical significance, so I didn't need to see a doctor or get any medical treatment. He added, though, that I should get the test repeated again in a few weeks to check it wasn't any worse. But the repeat results were exactly the same, and still no understanding or action was provided by the NHS hospital. The doctor was also keen to add the small print clause that he was only supposed to look at the blood results for hematology and not the results from the other medical specialties, as that wasn't the norm. He was prepared to comment on the other areas of the body in no detail at all. So I worked with Randox to really personalize my results with lifestyle, diet, supplementation, and I tracked the data of interest. I ate more protein, less sugar, and supplemented with iron and vitamin B12. Nothing improved. In fact, the protein proved too much for my body to digest. I started to develop kidney stones. As blood type A, I learned that my body didn't produce as much stomach acid as the other three blood types. Therefore, it took a lot of energy to break down meats and animal proteins, to the point where I thrive much better on a vegan-vegetarian diet, which I now do, and I feel great. I tried exercising to combat the adrenal fatigue, but I noticed I'd be really pale or faint or weak, and I was on iron supplements, and I shouldn't have been anemic. So the following year, when I was feeling like I had a bit more energy and assumed I just had naturally lower levels than the normal population, I went and had my second Randox Health program. This year, over 160 biomarkers measured because they add new tests every year on the same blood sample. The tests come from Randox Research and Development Laboratories because they actually specialize in advanced tests for early signs of any sort of illness that aren't available tests elsewhere. So I found out celiac disease antibody tests, mine were sky high. This meant that my body was actually attacking itself anytime I would eat gluten. This is an autoimmune condition which destroys the immune system. Celiac disease also attacks the digestive tract and makes it inactive, so it can't even absorb the vitamins or minerals, such as iron and vitamin B12, that I was taking in the supplementation. Celiac disease has actually been linked to infertility, thyroid problems, hormonal health problems, mental health problems like Alzheimer's, epilepsy, bipolar disease. So it was worrying. But because this disease has not been widely tested, the number of people living with it is supposed to be actually suspected to be higher than what it is. But once you know you have an autoimmune condition, you have to know that it's also, you're more susceptible to other medical problems and additional autoimmune conditions. Early identification with personalized testing and solutions is the key for preventing these diseases developing in the body. It's 1 in 4 people are said to have an autoimmune disease of some kind, and not only is this number continually rising, but autoimmune conditions are discussed as the early stages or precursors of many cancers now. This is making it one of the most important areas of science and medicine today. Celiac disease actually has genetic links, so I went and got tested more recently for those. Turns out I do have the genes associated, and Randox was showing me that the problem was expressing. But I've turned them off with the solutions that I could work out with Randox, and essentially I don't eat gluten. My test results are now no longer elevated for celiac disease. My iron and B12 are finally elevated to healthy levels because the time without gluten has allowed my gut lining to heal and absorb them. So these vitamins and my supplementation can actually work now. And actually my hormones have normalized as well. There was a separate issue that was addressed by Randox reports, which I hadn't even asked for an answer to. I hadn't had a menstrual period in 10 years. I'd been told by so many GPs and the NHS that it was nothing to worry about. They looked at me, told me I was not unwell, and I just probably was linked to ovarian cysts or working out or contraceptive pills or low iron or whatever. No further action was taken or offered by the NHS, but I was not happy to find out more recently that there's actually NHS documents for when you don't have periods or you have amenorrhea, that they're supposed to conduct tests. It can be linked to celiac disease, and it should have been done for me. So after 1 year of being gluten-free on the new anti-celiac solution from Randox, periods returned. Hooray. And after being as gluten-free as possible, which is not so easy, I can now list a whole host of my symptoms which arise if I'm exposed to gluten now. Brain fog, stomach bloating and distension, nosebleeds, headaches, heartburn, mouth ulcers. I get dry skin patches or really red, angry psoriasis patches. I'd fatigue, I'd be so tired, I would bruise really easily. Again, the amenorrhea, the no periods comes back. And even dizzy spells or feeling faint, lack of balance, and just lots of difficulties. There's actually a list of around 45 different symptoms that the NHS guidelines show are linked to celiac disease and doctors should be acting upon. So, in younger years, I must have just been accustomed to these revolving systems, and I didn't class myself as unwell or in need of a solution, but thank goodness for the testing at Randox. My favorite thing about finding out I had celiac disease, where do I start? No more side effects. I'm preventing so many other associated diseases that were slowly, clearly creeping in, and it's actually really preventable. So long as I don't eat any gluten-containing grains, all the good stuff though, like bread, pizza, cookies, cakes, anything with flour, then I won't see any difficulties or the disease won't damage me. The same is actually so true for so many conditions and diseases today. We have such amazing tests and technologies to find out what to personally focus on, and then we have so many solutions and actions available to us to stop any further problems in our futures. So I continue with Randox results and solutions throughout each and every year. I track my improvements every 6 months. I actually see the data improve and rebalance. I tell everyone that they'd be crazy not to go and get their answers as well. Go and get your health baseline with the latest and greatest test from Randox, and then you actually work to correct on it. So don't wait until you feel unwell or you have symptoms. Randox is designed to optimize your health, to prevent diseases developing before you're sick, so you can personally achieve lifelong well-being. So then I ensured my parents, my sister, my family were well, and made them get their Randox Health visits and checks in, especially with the genetic links, and my sister had always had unexplained sleepiness and brain fog. So not only did she too test positive for celiac disease, but it was then identified as a reason for her latest miscarriage and infertility struggles, plus severe anemia and migraines. According to the NHS, females should receive a celiac test after 3 or more miscarriages. The fact that a cheap, accessible, non-invasive blood test is not being used proactively to prevent such a critical physical and mental trauma in this modern world, even though fertility treatments and the industry is making people pay out money for this. So everything in your body is interlinked, working hard to keep us healthy, and everything in our lives has the potential to disrupt this and our health and actually start damage or disease at any given time. So in order to identify that and stop the chronic diseases progressing slowly within the body, because they last a lifetime, we get tested and we know that the early signs are reversible and preventable, and just tackle them early. Randox Health is like the science for resolving the early signs of health problems, preventing thousands of avoidable diseases in your future. Aging is an accelerator of diseases. Some people say it's a disease itself. So well-being is the optimization of health. It's anti-aging, it's longevity. And Randox Health is so much more than a health check. You should really come and see for yourself.